Once you figure out social media as a medical provider, life gets really good. So this is Wednesday right now. I'm recording, and this is in the middle of my patient care day. So I'm a psychiatrist, and I only see patients once a week. I have a concierge private practice where I see patients. And the rest of my time, I spend doing literally whatever. I work on my social media. I make YouTube videos. I take my mom out for lunch. I travel. The last couple weeks, I was actually traveling. I was in Cancun for a medical conference. And then fast forward after that, I went to I went on a cruise with my siblings on vacation. Or sorry, not with siblings, my sister, her boyfriend, and my parents and my sister's boyfriend's relative or his family. So we all went on vacation together for 7 days. After, I stayed in Miami for a couple days to visit a couple of my friends. I didn't take any vacation days. I didn't take any conference days. I just left. Like I just left to go on vacation. In June, we're going to be going on another vacation to Europe. And I didn't have to ask anyone that, oh, can I go on vacation? I just said, hey, I'm going on vacation. And so I block off my schedule. So all I'm going to do is I'm going to make sure that my YouTube videos are filmed, make sure that I just not have any patient schedule that week, refill any medications that I might need to, like, so I'll get internet on the cruise and just do that. But other than that, like, I am purely on vacation. And this is the life that's possible that when you're able to build a life, a following on social media, and you're able to monetize it. So, for example, for me, I have a psych NP community where I teach psych nurse practitioners psychiatry. And I'm so grateful to it because this has given me the freedom that I need to actually live life how I want it to be free. I wake up whenever I want to. I go to sleep whenever I want to. I literally, if I want to wake up at noon, I can. If I want to wake up at 9, I can. My favorite time to work out is actually in the mornings. And so just yesterday, I woke up around 9. I went to the gym to work out. And at that time, everyone's at work. So the gym was pretty much empty. Enjoyed the sauna by myself, then came home. Tomorrow, I'm going to be going to my boxing class around 9 a.m. ish. Then I'm going to go get a haircut around noon. And then I'm going to take my mom out for lunch. And then I'm going to work on some stuff later. Going to hang out with some of my cousins in the evening time. And so the reason I'm sharing this with you is because medicine has pretty much told us a lie. So medicine convinces us that we need to be working all the time. And this is what's going to help us to live life and be successful, and it's good to be working all the time. And so I remember thinking this because I was in my residency one time and I had an emergency room shift, and the emergency room shift was from 9 a.m. till 5 or 6 p.m. And then a patient came on at 6 p.m. This was during COVID times. And so they told us that, hey, even though your shift's ending, you're pretty much a healthcare hero and we could really use your help. And so I was in residency. So I'm like, whatever, okay, I'll do it. But then I was like, wait, hold on. We're just literally providing more free labor to the hospital systems. And of course, like they tell us BS, oh yeah, we're healthcare heroes and things to make us work more. And they'll make us also believe that medicine is a calling and it's a duty and that we should be doing this for the good of the patient. Who cares about our health and our sacrifice? And then when doctors and providers talk about burnout, they'll tell us, oh yeah, we care about medical burnout. But then they'll give us some wellness modules or they'll assign us more patients with lower pay. But we know that medicine pay is not increasing relative to inflation and relative to all the other demands all the other fields that are increasing, right? We're seeing these like crypto millionaires and OF models and all these things and influencers and who are making so much more money than us, working way less than us, feeling more life satisfaction than us. And then, at least for me, I couldn't help thinking that, wait, this medicine, it's a lie that they've sold us. What the heck? And that's why I'm having this channel, because I was able to achieve financial freedom, freedom, location freedom. Like I can live now wherever I want to. I can work as many hours or as little hours as I want to. So now I work 1 day a week. I get to see patients. I get to see the patients who want to see me and get to make meaningful quality impact in their lives, to spend longer on my patient care visits than the vast majority of psychiatrists. My patients get better outcomes because they like me, they trust me, they have a stronger therapeutic alliance with me. My patients are able to message me and I respond back to them on the same day. We have closer communication with them as well too. So all of it is just a win. And then I get to also teach my knowledge, help Psych NP, and so help them improve their practices as well. So yeah, basically that's the whole goal of this channel, is that I want to inspire more medical professionals, more doctors, more Ps, PAs, med students to get into social media. So that would, because this is the secret key, this is the tool that can really help you unlock the life that you want in with medicine or outside of medicine. Think about it. The old model used to be that, okay, you work in medicine for X or Y amount of years, you have some real estate or investment portfolio, and then you move out of medicine and then you go into that portfolio. That stuff takes 20 years, 30 years to fully develop. And we're not trying to get that freedom when I'm not trying to get that freedom when I'm 60. Like, I don't care about that. I want my freedom now. So when I'm 30, when I'm in my 30s, that's when I want my freedom. So whenever you are watching this, like, that's when you want freedom. You want that financial freedom, that location freedom, that time freedom. You don't want to be beholden to a hospital or some clinic that doesn't care about you 24/7, right? You want that freedom now. And so that's what social media has been able to do for me. And so that's what I want to help you do as well. And this is literally, it's so fresh for me. It's so fresh because I did my medical school, I did my residency, I did my fellowship. And so I've spent my time, a decade plus, in the system. And only from coming to the system, outside of the system, that I realized that, wow, like, it's really designed to keep us in, to use us like labor, basically to crank out our label, just to crank out patients. And then when we're done, we can't do it. It just spits us out and puts us like a slap or a pat on the back and says, okay, have a good day. But yeah, if this calls to you, if this appeals to you, right? My mission with this channel is to encourage healthcare providers to get on social media and to start posting and eventually get that freedom for themselves. So if you're new here, welcome. Keep watching and yeah, stay tuned for many more videos.